Is first aid for step 1 still relevant for a pass-fail step? First aid for step 1 has been helpful to many students that prepared for step 1. However, on 26th January, step 1 will become pass-fail. How will this affect the importance of first aid for step 1? First aid for step 1 still remains relevant. There are 3 reasons for this. Firstly, it provides a condensed material for reviewing the majority of topics that will be on step 1 exam. Since step 1 score will not be as important as other parts of the application, it is very important to spend as little time on step 1 preparation as possible. Therefore, leaving time for research, for example, first aid for step 1 provides the minimum amount of knowledge one has to know in order to pass it. The second reason for first aid maintaining its importance is that it helps in creating a mental scaffolding to reference within the clinical clerkships. Okay, learning the HMP shunt is not critical to any clinical case, but there is an important part of pathology and pharmacology to reference when treating and diagnosing a patient. For example, it is crucial to understand why the medication is not given to a certain patient, or how does it interfere with the pathology. Also, pathology is required to develop the reason behind the patient's management. For example, in exudative versus transudative pleural effusion, if we understand that the blockage of lymphatic drainage increases the risk of infection, we will understand that generally an exudative pleural effusion has the indication of drainage. On the other hand, since transudative pleural effusions are not linked with an increased risk of infection, they can be managed only with diuretics and water restriction. The third reason behind first aid for step 1 remaining extremely important is to score high on step 2 CK. Firstly, as NBLE has previously stated, more step 1 questions will be on step 2 CK exam. This means that having a good foundation with step 1 first aid will help to increase your score. The points that were given for the questions that were actually a step 1 question but now a step 2 CK part of the exam will be added to your score. Secondly, first aid for step 1 comes in handy for questions such as what is the underlying cause of the diagnosis. This frequent question for step 2 CK relies heavily on understanding the pathology of the disease. So for example, if you are given a question on a patient that experiences chest pain while doing a pharmacological stress test, you will know that we are talking about coronary steal syndrome, and you will understand the underlying pathology. Namely, you have a stenotic artery, and vasodilation of the coronary system will lead to stealing from the blocked artery. Another reason for the relevance of first aid step 1 to step 2 CK is the question type: what is the initial first step in management of the patient? This also relies on your understanding of pathology. One example could be a patient that comes with hyperemesis gravidarum at the ED, and you are asked what is the next step. You will know that hyperemesis gravidarum is influenced by beta HCG, which is in high amounts in the case of hydatidform mole. Therefore, if you want to get a diagnosis on hydatidform moles, you will start with dosing beta HCG. Now, is there a risk for first aid step 1 to become irrelevant? Yes. and that's because its role is to provide a condensed form of information that can be rapidly reviewed before exam or 3 to 6 months prior. However, there is a central tendency of first aid to become more and more thicker with more and more details as NBME tries to get more information into the step 1 exam. If there's not diligence from the author's part to select only the essential parts, then first aid for step 1 may become irrelevant.